Welcome to the Exceller Author Podcast. And today we are honored to host Dr. Sayantani Bhattacharjee, an accomplished healthcare professional entrepreneur and founder of Better Life Healthcare at the Last Mile. Through her book, she shares a remarkable journey of bringing quality healthcare to underserved communities in rural Assam and the lessons that she learned along the way. Ma'am, thank you so much for joining us, and we're glad to have you on board.
Thank you for having me.
Utmost pleasure, ma'am. My first question to you would be, how did the thought of In Search for a Better Life come to you?
So, in Search for a Better Life, this book is, about the entire journey of setting up my healthcare enterprise called Better Life in rural
Right.
Assam. And Better Life was born during COVID times. And the entire idea of, setting up this enterprise was because a lot of people in rural Assam were just dying during the COVID times because there was no basic healthcare facilities available in those regions. And as a doctor, I was seeing a lot of patients at that time. And
Mm.
the only thing that struck me was really to have a proper physical center where
Mm.
we could provide healthcare services, essential healthcare services to people around. And with that intention, Better Life was established in February 2021. And
Wow.
yeah, and thereafter, we've been growing Better Life. And the book is all about that journey.
Right. So wonderful thing, not only just the fact that you actually set up Better Life to curb the problems that you saw yourself, but you've also written a book about the journey and Better Life and what you saw to reach more people so that maybe they can set up their better lives in their parts of the country and worldwide.
Yes, absolutely.
Right. So, as a doctor and an entrepreneur, what inspired you to step beyond clinical practice and build the healthcare enterprise?
The most important reason is that as a doctor, when you
Yes.
just practice, you are very limited to only the well-being of your patient in
Mm.
terms of what you get to see the patient in your clinic.
You're right.
But if you see healthcare at large,
Mhm.
there are so many gaps and there are so many ample opportunities for really making it more organized and comprehensive for patients, that as a doctor I think that is a bigger moral responsibility. That is what I understood while working at the last mile for several years. I have even worked in areas like Sundarbans, before I really went to Assam. So in the last mile, the entire concept of healthcare is very different, and the basic deficiency or the basic gap is the absence of proper organized healthcare services for people. So I think that's the biggest inspiration. And that's why I called it Better Life, because through such endeavors, we can really make lives better for people. So that's first. And the second thing was also about, engaging and empowering local people to become
Mm.
change makers of their own
Right.
communities. So in
Mm.
Better Life, we also have this aspect where we have, employed,
Mm.
hired, and kind of trained local manpower who are now working as nurses and other paramedics, providing services to their own communities. So it was
Mm.
also an endeavor to make their lives better by giving them employment and empowering them. So I think these were the two primary inspirations behind setting up Better Life.
I think what Better Life is actually doing is that it's improving not just healthcare system but also the quality of life in that area. Because the
Absolutely.
moment they're getting more jobs, the moment they're getting exposed to these things, the quality of life has to automatically improve.
True,
And I do
true.
see a point in what you said earlier in your answer that your reach as a doctor is very limited as per what you see in the clinic and how what is exposed to you. Say,
Right.
for instance, if a person is from Sundarbans or some other area where there's no proper drinking water facility available,
Mm,
whatever water they're having is somehow corrupted or polluted. and then they're coming to you with cholera, jaundice, or whatever waterborne disease, and you have to treat them. You will
Mm-hmm.
ask them to have clean water, but the question is that how will they reach that clean water? So,
Correct.
I mean, as a doctor, you can just prescribe the medications, but you cannot do anything to actually improve the quality of life, which you have in your case curbed that barrier, and you have
Sure.
been able to improve to a certain extent. And I'm sure
Absolutely.
you will do much, much, much more better in the coming future. Better life will do
Yes.
even more better.
Thank you. Thank you for saying that.
My pleasure. So your work has taken you deep into the tea gardens of Assam. What experiences have left the most indelible, lasting mark on you? If you can share any one or two experiences that you have encountered.
Sure, sure. I mean, as far as experiences are concerned, I think there are new experiences every single day. So it's like a bag full of experiences really that we've
Right.
gathered over the last 6 years.
Mm-hmm.
But just to kind of tell you about two most important
All right.
takeaways.
Mm-hmm.
One, I would say, is the extreme disparity that exists in the population in terms of socioeconomic status, education, which
Mm-hmm.
thereby kind of affects their access to even essential services like healthcare. That disparity is huge when you go to last mile areas like that of Assam. This bridging of the gap, you know, that needs to be done, where healthcare is equally accessible to a person with money and maybe to a person who doesn't have enough money. That bridging of the gap has been done by Better Life in several cases. And the entire model of Better Life, that's why, is a very affordable model. So that people who do not have enough money, who cannot really even think of going to a nearby city. For example, Guwahati is the nearby city to our
Mm-hmm.
place of work. Even they can, get access to quality healthcare and be cured. So every single day we see patients and we treat patients of various kinds, of various, intensities of disease, who have received quality healthcare from us and are now, healthy. They are living a life free of pain, free of suffering, free of disease. So that is one takeaway. Secondly, I think what I have witnessed is a lot of gender inequality in that last
Ex-
mile area, where women who are uh, one of the most diseased sector of population in those areas are often neglected of healthcare, or they are not provided access to good healthcare because they
mm-hmm.
are not the decision makers. So they are
Right.
dependent on the men of their family who are the breadwinners, or who are the people who are going to pay for her healthcare. And that's why they are the decision makers, whether this woman would be treated or not, whether she would get the medicines that is prescribed or not. So that's again a very, very, significant thing that I have experienced, because in the city, you see a very different ball game altogether, especially in today's age, where women
Mm-hmm.
are, at par with men, and at many times women are even ahead of men. But if you go to the last mile areas, you see a very opposite picture.
Mm-hmm.
And again, a very important, crucial role of educating the society at large, so that women who are the homemakers, who are kind of, the pivots of their families, they
Mm-hmm.
need more healthcare
Okay, attention.
services, more education, more awareness. Because if a woman is healthy, her entire family is going to be healthy. So I think,
Even
yeah, I think these are the two very important things that you know we have to kind of cater to every single day.
one thing that came to my mind when you spoke about this particular gender inequality thing
Mm,
in those regions. It's not related to Assam, but it's also about a region that is probably very backward, probably either Bihar or Uttar Pradesh. I follow this doctor person on social media, Instagram, who posts educational reels and awareness reels and contents and stuff like that. She's
mm,
probably an intern in one of the hospitals there.
okay.
So she posted this video where this particular woman who's aged 22 has come to see her. She
Hmm.
has some issues with, she's a gynecologist, so she has some gynec issues, and which is serious. I mean, which means serious, probably an operation or something. And that doctor is also concerned about that woman. So the issue is that she cannot have any more babies for, say, like the next 1.5 years if she used to go through this operation. And by this time, if she's 22, she already has 5 babies. She's pregnant with the other one,
Mhm.
and the doctor is petrified of the situation, and she asked her, given your financial condition, given your condition, why have you taken so many issues, and why can't you stop? So what came out as a conclusion was that it was not ever according to her will. Whatever the husband felt like was correct or wanted was imposed on her, and
Right.
because she had to abide by what her husband wanted, she had to just agree to everything.
Right.
And so then the doctor had to convince her husband
Hmm.
and make him understand the situation and the magnanimity of it to curb the problems.
Hmm.
But it's really weird to see that a woman who's going through so much, who is supposed to go through this life-changing operation, has to look on to her husband to get the nod of approval,
Hmm.
just so that she can just take the necessary cares to be able to go through the procedure or not.
Right. Right.
So I'm sure probably that is also the kind of scenario that is there in the areas that you work in. A little here and there, but it's almost the same. And
Absolutely.
another thing that came to my mind is when you talked about affordability, the affordable model of the your healthcare on venture, is that these people should also have educational awareness and means to afford more healthcare schemes, because people who are educated like you and me, other people, we have healthcare schemes like health insurance and other medical claims and all of that. But these people don't have means to those things, and either that or they are not aware of these things, or they probably consider these things as something that the rich people do and we don't have to do it. But because they're the most vulnerable and of the vulnerable population, they should be the ones who should be getting these things done more than us, I think.
Correct. Correct. So again, I think a great role of education and awareness in this case
Mm-hmm.
also, because suppose if a person in the village buys a health insurance, to get
Mm.
benefit of the insurance, the person will have to travel to the nearby city because there are no
Mm.
hospitals empaneled
Office.
around.
Mm.
There are no
Mm.
hospitals at all. Firstly, and
Okay.
then when wherever the nearest nursing home might be, like for example, in our area, the nearest city is Guwahati, which is around 102 kilometers away from that place. So
Okay.
to get access or to get benefit of the health insurance, the person has to be able to travel that 102 kilometers to go and get admitted, right?
So when
So
an emergency is there, they have to travel that distance to get admitted in the first place.
if they are supposed to be empaneled under health insurance,
Right.
then,
Okay.
right? I
Okay.
mean, again, that is the role that Better Life has played. We are providing 24 into 7 services, and we
Mm.
take care of emergency medical care as well. So right now we are the solo providers of emergency care in our area.
That's great.
Yeah, but then if the health insurance part has to come, then either we have to grow so that we could be one of the empaneled
Mm-hmm.
hospitals under health insurance, or
Mm-hmm.
else the person has to travel that 100 kilometers and go and get admitted to a corporate empaneled hospital in Guwahati so that he or she can get that benefit. So there are a number of challenges that a
Mm.
beneficiary has when it comes to the last mile. So just doing one or two things isn't enough. The entire system has to be changed
Mm-hmm.
accordingly, and a
There's
lot
a
more
serious
entrepreneurs have to come in. Really.
Right. There's a serious issue of implementation also. Even if entrepreneurs do come up, like you, maybe others might also come up later on.
Hmm.
Uh, but even then, this mediation process is not being implemented properly. If they buy it, how do they implement that? But there is a gap there
Yeah,
which
yeah,
needs to be addressed by the government only, because
yeah.
they are the only ones who can do it probably.
Right. Also, the
Yeah.
insurance companies wouldn't empanel, OPD setup clinics with them. Health insurance
Okay.
people would only empanel hospitals who have, proper indoor facilities and everything.
Hmm.
But
Hmm.
then
Hmm. Hmm.
all patients do not need to be admitted in an indoor setup for treatment.
Hmm.
80% or more of treatment happens on an OPD basis. So there,
Hmm.
if norms in our country change, where
Hmm.
health insurance companies are also proactive enough to empanel people like us who are providing
Hmm.
comprehensive OPD care, then definitely a lot more people can really buy a health insurance and get access to it. So that's also
I
another
really hope
aspect of it.
I really hope that this video reaches to the people who should,
Yeah,
and someone out there feels the need to do things and comes forward and helps us.
absolutely. I
Uh,
hope so too.
yeah. I came across this newspaper cutting probably last 3 months back
Hmm.
about this rickshaw cooler from a village in Orissa who
Okay.
traveled 600 kilometers in his rickshaw with his sick, diseased wife
Hmm.
to reach the nearby hospital, get the procedure done, again
Hmm.
travel 600 kilometers from there in that rickshaw back to his village. So the
Hmm.
kind of hardship that they have to go through just to attain the bare minimum that probably people like us get at the comforts of our houses is way hard to imagine. Like
Absolutely,
it,
absolutely. And that's why you might have noted during COVID times, there were a lot
hmm,
of teleconsultation and telemedicine that really
hmm,
emerged
hmm, hmm,
and still continues till date.
hmm,
But
okay,
the real need is really to go into such places and go and work there. Because, if you are sitting in a city and if you are trying to do a teleconsultation over, a video call, that
hmm,
can
hmm,
only give a certain amount of access to you and to the patient both. But
hmm,
if you
hmm,
really have to make a difference and really have to, create a change, it's
hmm.
very important that you have to, leave your convenience and go down to such areas and,
Physically be
live
there.
and work there. Yeah.
Hmm.
And that is exactly what I have done when I built Better Life. So I just packed
Kudos
my
to
bag
you,
and baggage and
really.
shifted. Yeah.
So you
But
used to
that
lo- you used
was,
to you used to
yeah.
be here in Kolkata. You went
No,
to
no, no.
Assam,
I was in
presumably.
Guwahati. I was working in a
Okay,
hospital in Guwahati as a
okay,
medical
okay, okay.
superintendent. And I decided to shift my entire base from the city to the village when I decided to, build Better Life. Because there was
Wow.
no way that, I could have done this amount of work sitting in a city. That is not possible. Because as a doctor and as an entrepreneur also, if you don't
Hmm.
be in the real time field, you will miss out on a lot of things.
Definitely.
And definitely your beneficiaries will also not be able to connect with you completely, because it's not only writing a prescription for a patient, but
Hmm.
between a doctor and a patient, it's a lot
The
of
rapport should be
emotional,
there.
yeah,
Hmm.
it's a lot of emotional connect that happens, a lot of trust building happens.
Hmm.
So
Hmm.
that will only happen when both of us are in the same field. So that was another
So,
important
right.
input.
Now that
Yeah.
we have discussed some of the barriers and challenges that are there in the system,
Hmm.
what was your biggest challenge that you faced while building Better Life, and how did you overcome it?
So challenges were humongous, and every single day was a challenge. But just to name a few, I think firstly, when a woman decides to be an entrepreneur or wants to be a leader, the first obstacle comes from the society itself. And especially if you go to last mile areas where it's still it's a man dominated society, then a
Hmm.
lot of question marks and a lot of obstacles comes from your immediate
Hmm.
neighbors. So I
Hmm.
think that was one of the very big challenges that I had to overcome. I still kind of face it, but yes, the intensity has decreased a lot.
Hmm.
But initial days were extremely difficult. So there was nobody even willing to give me a space to, to start Better
Start.
Life. So, convincing them that yes, I being an outsider, I being a woman, I being somebody who's coming from the city, still wants to come and do good work in their area. Firstly, convincing them, building that conviction, amidst them, and then kind of, they agreeing to giving me a small place where I could start better life was the first biggest challenge. Secondly, when you go and work in last mile areas, everything is a challenge. You don't have electricity, you don't have drinking water, you don't have internet services. Logistics is a very big problem. Transportation is a problem. These kind of places are very prone to floods. You must be hearing every,
Mhm.
July and August there's flood in Assam. And this place that we work in, which is the Udalguri district, that is a flood prone area. So again, that is, one of the disasters that kind of keeps happening, that has become a normalcy to people. But then things are not normal, things are not feasible during such disasters.
Mhm.
So, you know, even getting access to basic amenities is a challenge, is the biggest challenge. So I think that. Thirdly, I would say getting access to manpower. As I said, you wouldn't get qualified manpower in such places.
Mhm.
So, picking up semi educated people, training them, giving them basic computer literacy, and, training them so that they can now face a client, they can now face a beneficiary and provide services. I think that has been a humongous challenge. Um, Again, I think assimilating all kind of services under one roof. In Better Life, we provide 25 plus services under the same roof. So
Wow.
assimilating all of that, assimilating the technology, especially because internet services are poor, getting other service providers on board wherever required, getting the necessary machines from the city, all of that has been a big challenge. So I think setting up the entire system, um, amidst so
Plus,
many
then sustaining
obstacles,
it.
and then sustaining it, then running it,
Mhm.
growing it, that's
Mhm.
the second level of challenge. But the initial levels of challenges are, as I just mentioned.
Mhm. So you just talked about the kind of not exactly backlash, but the kind of reactions you had to face
Hmm.
because you were a woman and you were not from this place, and you
Yeah,
were an entrepreneur trying to create some change in the area.
yeah,
So now you have progressed from that uh, area. Now you have progressed to a place where you have employed these people from the locality, and
hmm,
they're working with you, some under you, they're getting trained by you, and
yeah,
they're also they're also creating some kind of change in their own capacities. So
yeah.
how did you get to get these people to work? How did they, when, what happened that they started having that trust or faith in you?
There are two facets of this answer. One would be from the perspective of the beneficiaries, and one would be from the perspective of my own staff who are local people. Okay. So I'll give you both the perspectives in brief. So, as far as the beneficiary perspective is concerned, see, a sick person uh, this is what I always say, pain and suffering doesn't discriminate. It's
Mm.
equally painful for a poor person as much as it is for a rich person. Okay.
Very,
And
very
when a yeah, and when a person is sick or when a person is in pain, the only thing that really matters is getting relief from that pain.
Mhm.
So when people started gradually seeing that, we have created an affordable model where it
Mhm.
is budget friendly to them, and they
Mhm.
are getting clean and quality healthcare, and they
Mhm.
do not have to run to 10 different places to get access to 10 different things.
Mhm.
That kind of started, building a certain amount of um
Faith.
a faith, a certain amount of voice in the society, and
Mhm.
one person referred the other, and a lot of our patients are through referrals and word of mouth,
Mhm.
preaching of people who have got
Mhm.
benefits from us. And we are extremely proud that most of our patients who visit us once, they keep coming to us whenever required. So that way our customer retention levels are really high. And that
Mhm.
has only come from the quality of service that they get. Also, that we are accessible at all times. That is a major challenge for last mile areas. If you're not accessible to them at midnight, if you're not accessible to them on a Sunday, then a patient will obviously lose faith. So
Mm.
all of these gaps, you know, which are major challenges for a beneficiary, has been understood and has been filled up. So that's from the beneficiary's perspective. As far as the staff perspective is concerned, see, a staff who is a local person is also a victim of conditions and is also somebody who's maybe semi educated, might have done a preliminary graduation degree, suppose in nursing, and now is sitting unemployed at home because there are no job opportunities in her local area.
Mm.
When that person gets employment,
Mm.
she sees two things. A, there's a salary coming to her every day, and there's a certain respect that she now gains in the society because now she's a working nurse. Every single day, people see her, driving her scooty, wearing that white nurse dress, coming to the hospital, going back. So that gives her a lot of respect in the society now because she's not sitting at home. She's now a working woman providing service and being a local community person. When she is being able to serve another local person, that builds a mutual trust between both her and the patient. Okay, so better life is just a facilitator there. So these are the ways that we have empowered both the aspects of the society.
Right. What from what I can understand from your answers and what you have shared with me so far is that alongside being a doctor, you have really good understanding and grip over human resource management as well as entrepreneurial issues. This
Yeah,
is a commendable thing to have.
thank you so much.
I am an aspiring entrepreneur myself, but my area of interest is different, cultural study, cultural events and all of that. But I do understand the hassle and the pain. I'm in no way close to you in terms of scale and magnanimity, but I do understand the struggle one has to go through to understand these things that you do right now, and then the struggles that come in implementing them.
Right.
So it was wonderful talking to you, ma'am. And
Thank
my
you.
last question,
Sure.
my pleasure, ma'am, would be: how was your experience working with Excellent Books?
Yeah, I think Exceller Books has done a commendable job about publishing my book. Firstly, my sincere gratitude to them because I'm a first time author. So they have been kind enough to publish my book, and I think the continuous support that the book has been getting from them through different kind of activities right from the very launch of the book has been professional. And yeah, I look forward to publishing my subsequent books also with Exceller.
That's a wonderful thing to share. Thank you so much, ma'am, for joining us today. And I hope that you create a lot more impact, a lot more change in the places that you work in. I really hope that you spread wings to more and more places that need people like you. And I'm sure the people who read your book will definitely be inspired by your work and will probably also try and be change makers in their own way.
Thank you.
For
Thank you so
those,
much.
my pleasure, ma'am. So, for those who are looking to read a copy of this book, the book is available on Google Play as an ebook version and in print on Amazon.in, Amazon.com, Barnes and Nobles, and Bookscape. Thank you so much, ma'am, for joining us. Have a great, great day ahead.
You too. Thank you.
Thank you. Pleasure.